how serious is the threat posed by the virus right now?
There are few higher cases than usual reported in China right now, and that is why we are trying to diagnose more of such cases.
Is the surge in India, which is about 8 cases right now, is this linked to China as well?
The cases that we are seeing in India most likely are not imported from China, because this was the virus which was around us in India, in our country as well.
Is this a new strain that we are witnessing right now?
No, we haven't identified a new strain.
What are the symptoms one has to look for if one gets infected with this virus?
There are slight URTI symptoms, as we can see. We might have sore throat, it's rhinitis, we can have cough.
In India as well, we've seen all the 8 cases have been reported among children only. So, any specific age group that is more susceptible to this virus?
Most commonly, for the first time in our life, we usually contact this virus within 5 years of our age. And we keep on contacting this virus throughout our life. As we progress in our life, we do have antibodies against the virus due to our previous exposure.
How similar or different is this to the virus that caused COVID-19 pandemic?
Well, COVID-19 virus was a new virus in itself. It was a novel virus.
HMPV, Human Metapneumovirus, two words which have been making headlines over the past few days. India has now stepped up surveillance after the country reported about 8 cases. The health minister of the country has asked people not to panic as the situation is under control. But given what the world witnessed back in 2020 and the kind of visuals we are now seeing coming from China with hospitals packed with patients infected with HMPV, there is a wave of fear among public. So now, to bust the myths and understand the do's and don'ts about this new virus, we're being joined by Dr. Mohit Choudhury. He's a senior resident in the Infectious Disease Department at AIIMS, New Delhi. Thank you, Dr. Choudhury, for joining us on India Today Global.
Thank you, Ishita, for having me here.
All right, doctor, my first question to you is, and this is a question that's on everyone's mind, how serious is the threat posed by the virus right now? And is the world staring at a pandemic-like situation again?
Well, the first thing I would like to clarify is that the thing that we need right now is not to panic. This is a virus which has been around us for quite some time. It was discovered way back 23 years ago, and it has been causing one of the most common colds that we know, the one which are more prevalent in the winter season, and it has been around us in the past few years. Although it was not getting the headlines it needed, there are few higher cases than usual reported in China right now, and that is why we are trying to diagnose more of such cases. But fortunately, these cases are the ones which are milder in type and haven't got much serious than it was previously reported as well.
All right, please paint us a picture for us. Globally, are we only seeing a surge in China, India, or are there other countries that are also witnessing a surge? And is this surge in India, which is about 8 cases right now, is this linked to China as well?
Well, it has been reported from a lot of countries in the northern hemisphere. It previously used to be prevalent again in a lot of countries in the northern hemisphere, and the usual time used to be the winter season till the arrival of spring. So it is the same thing we are seeing this year as well. And apart from China, there has been other Southeastern Asian countries which has reported these cases. And the cases that we are seeing in India most likely are not imported from China, because this was the virus which was around us in India, in our country as well, and used to cause disease more commonly in children as compared to adults. Although if we can identify these cases, we can identify both in children and adults.
All right, now you've mentioned that this is not a new virus. It was first identified in about, I think, 2001. So I want to ask you, is this a new strain that we're witnessing right now?
Again, no, we haven't identified a new strain, although there are minor changes in the virus which is circulating every year. So we have seen a minor change again this year, but there's no major antigenic shift which can cause a major pandemic-like situation.
All right. So when we talk about the cases which are coming up, what are the symptoms one has to look for if one gets infected with this virus?
So again, most commonly, there are slight URTI symptoms, as we can see. We might have sore throat, it's rhinitis, we can have cough. Children usually predominantly have fever as well, whereas adults might not mount a fever. So this is the usual pattern in most of the cases, till the person is already having low immunity due to certain other diseases or previous lung conditions. they might have a bit of serious disease, but again, the preponderance is pretty low.
All right, you mentioned that immunocompromised people could develop severe cases as well. And you also mentioned that there are certain age groups. In India as well, you've seen all the 8 cases have been reported among children only. So,
Mhm.
any specific age group that is more susceptible to this virus?
Again, since we have to know the pathophysiology, as we have already discussed, this was a virus which was among us. So, most
Yeah.
commonly, for the first time in our life, we usually contact this virus within 5 years of our age. And we keep on contacting this virus throughout our life.
Okay.
As we progress in our life, we do have antibodies against the virus due to our previous exposure. So, the disease keeps on getting milder every time. So again, if we see the disease's preponderance symptoms would be higher in children who are contacting this disease for the first time.
Oh.
And post the lockdowns and strict isolation measures of COVID, there was decreased exposure to this virus in certain population, and that is why we might see a certain surge in these cases because of low immunity to this virus recently.
You've mentioned COVID, and doctor, I have to ask you this because a lot of people have been drawing comparisons between this and coronavirus. So, how similar or different is this to the virus that caused COVID-19 pandemic?
Well, COVID-19 virus was a new virus in itself. It was a novel virus.
Okay.
It had a major antigenic shift from the previously isolated ones. Thus, we didn't had immunity to that virus. It caused a pandemic. Due to the sheer higher number, we saw a lot of serious cases as well. Whereas compared to COVID, as we have discussed, we already had this virus in circulation, and so a lot of us already have antibodies to it. So it's unlikely that it would cause a pandemic, and serious cases would again be less in number due to the sheer absolute decrease in the number of the cases.
All right. So, are there any particular steps that people could take, precautionary measures that could be put in place?
Again, as we have seen in the COVID, this has a similar transmission route.
Yeah.
That is via aerosol or droplet transmission. So what we need to do is wear masks when we are in public, have a strict hand hygiene protocol, avoid overcrowded places, and if we are having any symptom, we should start isolating ourselves. And if the symptoms are mild, just isolate yourself at home, take care of yourself till you have a severe symptom, in which case you obviously need to visit a hospital or consult a doctor.
All right. My last question to you, doctor, is this: you are somebody who's been practicing for long. You have witnessed what the world and, of course, India went through during the COVID-19 pandemic. So, I want to ask you, what are the lessons that India learned from that pandemic? And if I hope that doesn't happen, but if India does witness a surge in these cases, is India prepared to handle that situation?
Okay, so that's a difficult question to answer. Although, as we had seen that we were a bit lagging while we encountered the second wave of COVID, which was the largest one. We had very high number of cases, but we didn't have the infrastructure or the oxygen supply requirement and various other infrastructural requirements that we need. So right now, again, if we have a surge of such cases which needs hospitalization, we would need more isolation wards. We will need more manpower in the healthcare. Although, given the current situation and the virus which is circulating, it's highly unlikely that we would need such a requirement of the infrastructure as we had seen in the previous waves of COVID. So most of the cases should be mild and should require only home isolation.
Doctor, my last question for you is now, do you have any message? Because we have seen, a lot of hysteria on social media, people thinking and wondering what happens if India goes into lockdown again and, a cases actually surge. So your last message, coming from doctor fraternity to people.
My message to our people in our country would be, let's not panic right now. Lead your regular lives. This is something which was always around us and will be around us in the future as well. Just follow strict hand hygiene and other precautions which can prevent the disease from engulfing you. Wear your mask when you go out. Try to avoid overcrowded places. Wear your mask. Avoid overcrowded places. Maintain strict hand hygiene using sanitizers, maybe pocket sanitizers. And if you have symptoms, just stay at home and don't panic. This is something which is not going to take our nation down again.
Yeah, exactly. My question to you, my another question was this, that if somebody does actually get symptoms like this, so what are the steps for that person? Do you think home isolation is better right now?
So if you're developing a symptom, stay
Yeah.
at home, maintain complete isolation from your
Hmm.
family members, do steam inhalation twice a
Okay.
day. You can take paracetamol if you have fever. Check for your symptoms. If there's any warning sign as breathlessness or any increased cough, or if you can see chest pain or any other thing, then you can go to a hospital or visit a doctor. Otherwise, stay at home, be safe.
Thank you, Dr. Choudhury, for summarizing the symptoms, the precautionary steps, and the surge of HMPV cases in India for us. And that's a message coming at you from Dr. Choudhury himself, somebody who leads the infectious disease department at AIIMS New Delhi. Stay tuned to India Today Global, where we simplify geopolitics for you.